was actually born with a slightly uneven hairline. So I wanted that normal, you know, natural straight hairline.
We went about trying to achieve that by bringing the hairline lower. Forehead, of course, became smaller as a result, and then we also brought forward your temple points.
Yes.
This is more of trying to get a hairline and a temple that meets your taste rather than just trying to restore a hairline from hair loss. Bringing a hairline this aggressively down is something one does only in patients who do not have hair loss. Because in your case, we're not worried about progression of hair loss. So you do have the donor supply to do whatever you want. It's a very full looking head of hair with no signs of hair loss whatsoever. He had a total of 3,200 grafts to achieve this look. Why does it take a lot of grafts to do that? If you're doing a transplant that involves coming forward, the further forward you get, the more density you have to add for it to look credible. This kind of hairline assumes that you have a very high density. So for it to look natural, you have to have a lot of hair. And as you can see, it's like 4 centimeters away from the eyebrow. Aggressive hairline restoration usually will bring it to within 6.5 to 7 centimeters from the eyebrow, and here we are just about 4 centimeters from the eyebrow. So that's to highlight how different the situation is. Pay attention to the temple point. This temple point is all constructed. The original temple was further back. We created a very sharp angular temple point to complement the hairline. This type of temple point goes with his facial structure. He has an equivalent facial structure, and it calls for sharp angle temple points. And that's what we did here. The hair on the temple point points backwards. It's directed backwards, and then the hair up right there is pointing forward. The doctor or the hair transplant provider needs to be able to make this transition in angles seamless, so it looks natural. And you can see that that's been achieved here. The donor area is looking quite full and robust. No sign of depletion whatsoever. No unusual patterns because the extraction was done uniformly. We also took hair from the nape area. There is no indication whatsoever that the density was compromised or the hair distribution pattern is abnormal. Goes without saying you're happy with the results.
Very happy.
By the way, have you had any third-party input? Anybody looked at your hair and go,
yes.
Oh, what's that?
They all said it looks very natural. Full head of hair. Very happy with Dr. UGraft.